Cataract and refractive.
Hello, hello,
Yeah.
yes. Yeah, perfect. Good afternoon, everybody. So we have very, very little time to make any advances, but I will start with the recent advances in cataract and refractive surgery. So I think one of the major thing which is happening is that there are newer biometric machines which have been launched, and we already know that swept source is the thing to go, and there might be even more advances in times to come. We already have 3 or 4 based on swept source OCT, and they're working further on integrating that with even faster OCTs which are available. Intraoperative wavefront biometry was there since many years, but probably in times to come when the machines are getting faster and faster, it might get relaunched with faster hardware. Now, newer formulas, as you know, that the old formulas are, getting outdated every year, and we are now using Barrett, but I'm sure that we are going to shift to many more AI-based formulas, like Hill RBF has already shifted to AI-based formula, and there will be many more AI-based formulas which will be coming. And these are particularly useful because now we are going towards refractive lens exchange more and more. So we need least of these refractive surprises. So all these formulas are newer formulas, and also they are getting added with AI. So nowadays, I think probably in a year's time, Barrett formula will also get an AI update. Now, newer IOLs are already there with diffractive, refractive, and small aperture. You know that the same kind of optics, but they are always refining over a period of time to get best quality of vision and best range of vision in our patients. ICIT is launched, I think, this year in India also, and it's a incredible IL for particularly post-refractive surgery and in cases where the cornea is extremely irregular. PORC is the new kid on the block for EDOF IOLs. Now, this is one AI, which is designed by AI, which is a Galaxy Spiral IOL. It is just launched, so first surgery was done just few days back in India, and it has some promising results. Light adjustable IOLs already, launched in USA, it's still to be approved in India, but I think this is something which is exciting. So mixed reports are there from US, but the good thing about this is that after you implant the IOL, we can always nudge around the results. Even you have 2 attempts to try, like you can try EDOF first and then or monovision first, and if the patient is not comfortable, you can reverse that. So that is something exciting to look after. I think in few patients it is really, really good. Only thing is that post-operative period, the patient has to wear the UV blocking glasses in the outdoors as well as indoors for till the time that you fix the power that the patient needs. So that is something very exciting, and we are looking forward that it will be launched in India very, very soon. Accommodative IOL, of course, they did a lot of, kind of noise earlier, but later they failed because it didn't have the, continuation of its effect for a long time. But now they are coming back in the picture. You know that the crystal lens has already gone out of the market, but there are newer dual optic designs which appear to be more kind of promising with now they are entering the clinical trials as well. Fluid field IOL like Juvin, Fluid Vision are also in the clinical trials now. So probably we'll get to know about this next year. Now, as prelex is increasing, we have to be more and more accurate, as you know. And for pre-operative diagnostic, I think ITRIS launched many years earlier, but now it is refining further with DLI calculation. So I think we'll be screening many patients much earlier for cataract. Now, there is this exciting new technique of refractive index shaping. So it can just shape the cornea, and same way it can shape the IOL after it has been put inside the eye. So that is something similar to LAL, but we can do it using the laser. Now, we are going to be jobless very, very soon because now the robot-assisted cataract surgery is there. So probably after 10 years, instead of me, a robot will be taking this lecture. Zeiss Micor has come with the handheld phaco machine, so you don't have to invest in Centurion and Quatera and anything. You can just buy a small device for each and every patient, disposable. This is a Omega artificial capsular bag, amazing. You know, you put a bag inside the bag and it stays there forever. You can put many devices, including maybe, kind of AI glasses inside these IOLs. It will show you augmented reality like Avatar, and you will be seeing entire world through that. Is going to come. For refractive surgery, I think KLX is already established technique. It's refined further, mainly introduced by many other names like Silk. It's very nice, looking soft. Vizumax, Z8, all clear, everything. Z8 is amazing because you can just move it around. For a country like India, I think economy plays major role. Wavelight Plus, another innovation with ray tracing technology introduced in excimer laser. So I think we are going to make the LASIK, excimer, everything more and more customized to have 6 by 3, 6 by 2, 6 by 1 vision. And this is IV suit. This is exciting because you can operate now sitting in India, in Italy, or US, but just by giving commands, probably later voice commands, that you check the patient, so the machine will check the patient, check the refraction, and finally operate with excimer laser. And it has already happened a couple of months back where the surgeons operated from Bangalore on a patient in Italy. So these are the new exciting things which are in the cataract and refractive surgery. Thank